Well, amid the ongoing concerns of the coronavirus, the Senate's recess is getting longer. Today, Majority Leader Mitch McConnell announced senators won't reconvene on Capitol Hill until at least May 4th. The move comes as the number of confirmed cases in the United States continues to grow. Nearly 585,000 Americans have tested positive, and almost 25,000 have died in the outbreak. And with us now is Dr. Jen Ashton, Chief Medical Correspondent for ABC News. Great to see you again. Dr. Ashton, with improving situations in hot zones like New York, Washington State, and California, are we beginning to see the light at the end of the tunnel?
I don't think anyone knows the answer to that, John. The reality is that social distancing measures are effective, and when we start to see a steadying or then a decline of case rates and fatalities, which there is always a lag time for that to occur, then of course that's encouraging. But part of the dilemma is with these social distancing measures, when you see these things start to improve, you can be lulled into a false sense of security that there's some arbitrary time point that we've passed and we can just resume our daily activities. And there's pretty much general consensus that if that were to occur, the number of cases and deaths would just go right back up again.
Dr. Ashton, along those same lines, as pressure mounts to reopen the country, we're hearing more about the need for aggressive contact tracing before scaling back the prevention measures currently in place. Can you explain what that means and why it's so critical before we can get back to normal?
Sure. So when you talk about testing, there's really two arms to this process. One is to test people who have symptoms with a nasal swab. That's generally a PCR test, and hopefully that will be more widespread so people can get those results as quickly as 15 minutes. And then there's antibody testing, which is generally done with blood, and that will generally tell us who's susceptible, who's infected, and who has recovered. They serve different purposes, and we still don't know the accuracy of them and really when to test people, who to test, how often to test. We're still learning a lot about this virus. But when you talk about contact tracing, the premise of that is that because it is thought that 25 to 50% of coronavirus can be spread by people who have no symptoms at all, it's very important to be able to test huge numbers of people, including those who have no symptoms, so that if we get a positive result, that person is isolated for, let's say, a period of 2 weeks, and then they're questioned about who they've been in contact with, and those contacts are then contacted, told to quarantine, and ideally be tested as well, so that you can actually stop the transmission in the community of this virus.
So it seems more targeted. With some states, or rather some states are taking a regional approach in coordinating their efforts to reopen. I want to get your thoughts on that versus reopening the country all at once.
Well, I think, if you listen to Dr. Anthony Fauci and the nation's top epidemiologists, there is general consensus that opening the country in one fell swoop like a light switch is generally thought to be a bad idea. And we have to remember that people's lives are at stake here. So it will basically just have everything we've done in the last couple of weeks and months be for naught. If we just rip the Band-Aid off and go right back to the way things were, the cases will go up again. The virus is still there, and it's powerful and it's sneaky. So I think when you talk about states or regions coordinating a response, that may be a good option. This is a complicated situation, and there are some hopefully very smart people working on it, thinking of it from a lot of different angles, but also understand that it's not just states or cities or regions that need to think about how they reopen. It's even populations within a given area. So within a city or state, let's say maybe you maintain more vigorous and aggressive social distancing measures for more vulnerable populations like the elderly, people in nursing homes, or people who are hospitalized. It might be certain areas of the country with more vulnerable populations, less access to testing, less access to health care. Maybe they get reopened more slowly or with different provisions provisions in place. So there have to be a lot of different scenarios taken into account before a random decision is made that can affect people's lives.
All right, Dr. Jen Ashton, we're just going to have to leave it there with ABC News. Thank you for making time for us.